Hey, everybody. Welcome to the Eat, Pray, Faith podcast with Tracy Stroup, ND. That is me. I am Dr. Tracy, and I'm so excited that you're here. Today, we're going to be talking about medical freedom in that term. What does it really mean? I always say it's an oxymoron because there really is no freedom in medicine. Um, so I just want to clarify moving into this, I'm not against the medical system. I'm just against the initial first choice positioning of it. And also the health insurance racket that we've been indoctrinated to believe is what we really need. So I want to talk today about four specific points. Number one, positioning the medical system where it should be. Number two, the history of how we got here, wrapped up in this insurance plan, health care policy, benefits packages, along with how did we position medicine as the first choice. Third, what is true health freedom? What does that actually mean? And how do we attain that? And number four, just giving you guys some, information and alternatives of what you can do and where you can go to begin your journey out of what I consider the medical system prison. So, first of all, let's talk about my position on the medical system. Number one, it's not the people in the system, it's the system. And this goes way back in history, and we're going to talk about it. And if people are listening to this today and don't think that the medical system is all about money and actually benefiting from your disease, I don't know how else to tell you this, but it totally is. There's no other system in the world that benefits from the suffering of people. And I think it's amazing. And actually, if you don't think it's big business, there's an article that just came out about United Health's latest acquisition being shady in their pretense. This was published in the American Prospect and Stat News. And basically, what it said was United Healthcare is actually acquiring and buying clinics in a recent spree, targeting areas of the country where it has a significant enrollment in its Medicare Advantage plans. That's a very strategic move, which allows the company to steer more seniors to the facilities it owns, boosting revenues it gets from the government and padding its bottom line. I mean, I think that's amazing. Now, here was what was more amazing, and I actually highlighted this in the article, and I'm going to share this in the details of this podcast so you can go back and look at those details and look at all the resources. But according to this article, and this was written by Wendell Potter, who actually is the former VP, whistleblower and reformed insurance propagandist. So he writes a lot of things on the healthcare system in his Substack. It's a really good Substack if you want to get some really good, valid information. But United Healthcare's long string of acquisitions in the recent years has captured the company to the number 5 spot on the Fortune 500 list of American companies based on revenue. This is a healthcare company who's the 5th largest company on the Fortune 500 list. The only other companies that beat it are Walmart, ExxonMobil, Amazon, and Apple. If that doesn't give you some insight as to how much money can actually be made in the disease management plan and system and how this has strategically come to be, I don't know what else to say to you. So, first of all, like I said, I'm not against the medical system. I do believe that it is an acute trauma care model, which is what it should have been and is educated to be. When physicians go through medical school, they learn diagnostics, they learn pharmacology, they specialize in different areas such as surgery, pediatrics, cardiovascular. They graduate, they do their internships within those specializations, and they go forth. Now, it really astounds me that the medical system that's not trained in lifestyle medicine, in nutrition, in complementary modalities that will help people get well, will help people attain health, get to the root cause of the issue, maintain health, and then sustain health, that they're the first choice for most people. And really, if we look at insurance and what the claims are for the majority of what's submitted, most of the things that people go to the medical system for can be drastically altered with just good lifestyle and health. So what happened? How did we get here? honestly, if you have a heart attack or if you need a surgery, that's what the medical system is for. It's acute trauma. And I'm not downing that it's substantial in those areas. What I am saying is that lifestyle choices, accountability, and responsibility on behalf of the people, us, the people, should be where we go and what we do. And the problem is we've been indoctrinated with this non-suffering model that if you don't feel well, or you have a slight pain, that you run and you get a pharmaceutical that is going to repress that symptom. And I always say, God is a waymaker, and these physical discernments or symptoms that God has given our bodies to express are actually signs that something needs addressed. And there's only really two causes of all dis-ease in the body. It's nutritional deficiency and toxicity. You don't have a pharmaceutical deficiency. And there are some diseases that do require medication for those particular things, such as diabetes type 1. That's what medicine is there for. But for far too long, we've been pushed and indoctrinated to seek out the need of pharmaceuticals. Case in point, and here's just something to think about. How many pharmaceutical commercials do you see on your TV today? If you even watch TV, which I normally don't, but they're everywhere. They're even floating into ads on your YouTube TV or whatever streaming service you have. But these commercials are brilliant. Number one, they put out a sense of, you're going to feel nostalgic and wonderful and symptom free. Number two, the underlying talk or current is some guy in the background telling you about all the horrible side effects that you might experience. But the subliminal undertone of that commercial is take away my suffering, take away my pain. And there's only two motivational points of any human. It's pain or pleasure. So if I'm going to tell you I'm going to relieve your pain and you're going to have pleasure, that's a massive motivator because you have both points of motivation in that. And then third, it amazes me that the pharmaceutical companies can actually advertise to you because this is a product that you can't buy. So I think it's a brilliant scheme on their part to come out and say, hey, go ask your doctor for this medication. So what do? You go in and you ask your doctor because you've researched on Dr. Google all the things that are wrong with you. And you go ask your doctor for this medication, and he or she will provide it for you. So they don't have to provide you informed consent at that point because you've given that up. You went in and sought out the medication yourself. So the system's brilliant. It basically indoctrinates and brainwashes us to seek out pharmaceutical drugs to repress our symptomology that is telling us that something's wrong at the core. And so you do that long enough over and over again. What happens is you start to get a lot of side effects from these medications because they are synthetic. So what was the history of how we got here in big medicine taking over what we now call healthcare? And I think this all goes back to what we know as the Flexner Report. If you're familiar with what the Flexner Report is, then you understand that Flexner actually went and did a report based on funding given to him by the Carnegies, the Rockefellers, and Gates. And so it's pretty interesting if you go through the history, and you can find this on the NIH government website, 100 Years of the Flexner Report. Again, I'm going to provide you all these links, but this really transformed the nature and process of medical education. And what Flexner did was, after the induction of sick care, which had been around, I mean, the history of sick care has been around for a while. So let's just set back just a little bit. During the Civil War and beyond, there was need in the workplace and due to wars that people needed some sick care. And the sick care was really positioned for people that were sick. So they could take time off work. And the people that worked at factories or facilities would provide a little bit of their their paychecks into this fund, and it would sit there in case anybody got sick or couldn't work. And at that time, it would provide about 60% of their wages, and that's really what it was for. So during this time, we had this transition of these medical schools, and my friend Dr. Sherry Tenpenny did a really great Substack on what was called years in the making. And this was a great little article that pointed out how did we get to this system of medicine and alternative care. And so again, I'm going to share this for you. But this article that was published in the New England Journal of Medicine by Eisenberg was called Unconventional Medicine in the United States, Prevalence, Costs, and Patterns of Use. And really what happened was it was one of the first articles that came out and said, there's about 72% of people, 83% of people who also sought out treatment for the same condition in the alternative space as they did for a medical doctor. And why aren't we looking at these? And so she really went back and looked at the amount spent on alternative therapies, which is mostly out of pocket, because that's the very first question that I'll get is, do you take insurance? And it's because people are just used to using their insurance for things. But I really think it's an interesting model that you'll pay on average $400 to $700 per person, or on average $1,437 a month for a family of four for health insurance that gives you very minimal benefits when it comes to lifestyle modification care, supplementation, alternative therapies, and things that most people are seeking out. 22.6 billion in 1990, 32.7 billion in 1997. That's an increase of 45% between 1990 and 1997, excluding inflation, on money spent on alternative therapies that are not covered by your health insurance policy. So this sick care system that was brought up, people paid into it. What happened was, with the Flexner report, they started to see that, there was competition between what was considered homeopathic schools and what was considered medical schools. So the alternative schools were actually first. And I hate the term alternative because we're not alternative. We're the first. We are the first medicine. And so this evolution of the MD profession basically came from medical physicians realizing that people were seeking out these homeopathic physicians that were trained. They were seeking out the herbalists, the lifestyle modification, the medications and homeopathy that had always been that people had used and that they knew worked. And Dr. Hahnemann, who's considered the father of homeopathy, basically went with the law of minimums. And so he didn't want this ridiculous drug-based pharmacological stacking approach. He went with very minimal likes cure, likes philosophy, and that's the whole premise of homeopathy. And if you don't know what homeopathy is, you can go research that, but it's one of the modalities that I use in my practice. So the evolution of the American Medical Association, the AMA, well, this was founded in 1847, and it was because they had little tolerance for these therapies, such as homeopathy, such as herbal remedies and whatnot. And so the AMA set forth to do three things. One, it wanted to establish the medical licensing laws and restrict the number of physicians in any given state. And the intent was to create a more stable economic climate by inhibiting the amount of competition, i.e., the alternative practitioners. Number two, it was the destruction of the most of existing medical schools. This was the Flexner report, which was backed by the Carnegies, the Rockefellers, and Gates. And they basically went to all the medical schools and did an evaluation. And if you were not using pharmacology, which was supplied by the Rockefellers after the war, because they had an excess amount of petroleum, which is what most medications are made from, then you were considered non-credentialed or not to be taken seriously. And so what they tried to do was create these medical schools that had a smaller network, that were pharmacologically based, that taught pharmaceutical medicine and not these eclectic alternative practices. And then they also wanted to get rid of these other medical sects, unwelcome and competitive forces with their own profession. There was a push to eliminate midwifery by moving births from homes to hospitals where midwives were forbidden to practice. So I always tell people birth is not a medical condition. That baby's coming out. And actually, our rate of babies dying actually increases due to C-sections, due to the use of all kinds of drugs to induce labor. It can actually slow down the respiration of the baby due to the practices that we have in there, such as putting antibiotics into the baby's eyes, and all kinds of things actually increase the issues that we have with our infants. And some of these things even increase death. So we have to remember that the medical system, the AMA, the American Medical Association, was first formed in order to provide medical physicians a more even playing field because people didn't want their medicine. And now here we are, a couple of 100 years later, and this medical system has really, taken over despite the fact that people, according to this Eisenberg study, are seeking out alternative therapies. So I think it's just amazing that although the people want alternative therapies and want to spend money on them, they'll still keep this medical insurance policy over here on the side as a safety net. So let's talk about that a little bit. I want to go over some statistics with you because the very first thing I'll hear from people is, well, I have insurance just in case. And I totally understand that. 91.7% of Americans have health insurance. And I did a little post on Truth Social about the fact that the history of medical insurance, really started in the United States around the 1900s, and it came out of the sick care model and then just kind of blew up, as the safety net for people, but it doesn't really provide you with all the things that you're seeking. So the annual cost, as I said before, monthly breakdown is $400 to $600 per person and $1,437 for a family of four. That's per month. That's a house payment, guys. If you're an employer, your cost per family is about $6,000 a year, and per individual is about $1,300 a year. So there are employee benefits and tax breaks now, so that there's more incentive for you to push insurance onto your employees, in the name of health. Although that's really not what's going to bring them to health. That's going to bring them to symptom repression and more claims later on that health insurance policy. So your top claims, and this is what I found fascinating because I went and I put this link in the details so that you can see the report. The top claims for health insurance policies by individuals are as follows. Number one, cardiovascular disease. Still 877,000 plus people die every year of cardiovascular disease, and probably more now after the pokey poke. Diabetes. $327 billion in cost for that. I thought that was astounding. And diabetes, about 34 million Americans suffer from diabetes. Of those, about 2 million people are actually diabetic type 1. So I only point that out to say, and I just want you guys to hear me on this, is cardiovascular disease and diabetes, according to the World Health Organization, not that I give them any credit whatsoever, but it makes people feel better, and other fake government agencies that proclaim to want to, benefit your health, are preventable and actually reversible, diabetes type 2 and cardiovascular disease, by lifestyle changes. So if that's the case, why are we throwing health insurance coverage on drugs and surgeries versus maybe organic whole food eating, optimizing a Mediterranean diet, supplementations for, cardiovascular health, things like nitric oxide, things that are going to repair vascular issues, things that are going to help cholesterol naturally lower. Cholesterol is not bad. I'll do a whole show on that. So top two claims on insurances are reversible by lifestyle change. Okay, the third one is arthritis. Total cost of arthritis was estimated at $304 billion, split between $140 billion in direct medical expenses and $164 billion related to productivity and care management loss. So these people, are not mobile, or, so much so that they have, other issues of productivity, and they also have medical expenses. So third, alcohol-related health issues. That tells us a lot about our country and what we are using health insurance for. So I'm just going to stop and share a little story with you. So about in November, my mom got sick, and she actually had a MRSA infection in her blood. We went to the hospital, and she was so sick, tried all the natural remedies. As I said, not against the medical system. We use it for what we can. So I tried to do everything I could at home. And then I finally said, you know what? She's 82 years old. She has smoked her whole life. She's not in optimal health, not on any medications, mind you, and wasn't sick prior to this, but it was such a drastic sickness that I thought we should take her in. So I took her in, and my 82-year-old mother sat in the waiting room for a very long time, very, very sick, or in the hallway for a very long time, very, very sick. We actually arrived by ambulance because I did call the ambulance to bring her in. And so we're sitting there in the hallway of the emergency room with an IV hooked up to her, a very small blanket, hustling and bustling all around us. And we were there for 9 hours with no indication that there would be a room. Now, the ER staff, I will say, is doing everything they can. They were very nice. The ER doctor was very open to hearing my suggestions on this is not a virus. There's something else wrong. My mom never gets sick. Please dive deeper, look deeper. And so she did. She ran some very specific tests for infectious disease, and that's how they found it. Anyway, my point was during those 9 hours, I watched rooms around us in the emergency room get filled up. And this is no disrespect. I mean, nothing against anybody that has an addiction issue. That is an issue. But with drug addicts and people that were intoxicated and homeless. That's who they were putting in the rooms. And all of the people that were actually really, really sick, like my mom, who could have died, was sitting in the hallway at 82 years old, cold, with an IV. It was an atrocity. So we did manage to talk to the charge nurse, kind of not really, I wouldn't say we were unkind, but more forceful. As I said, this is ridiculous. The staff there agreed it was ridiculous. They don't want to be in that system, but that's the system we're in. So when your fourth top claim on health insurance is alcohol-related incidences, it goes to show you, what's happening in our society. Number 5 is cancer. Oh, let me go back to alcohol-related issues. This is a $249 billion, or roughly $2.05 per drink, alcohol-related deaths, total 95,000 people per year, and shorten the lives of working adults by the average of 30 years. So you want to talk about a huge impact that is 100% lifestyle related. Yes, it's going to require a modification of habits, lifestyle, behavior, supplementation, nutrition, all the things. And like I said, I'm not downing addicts because it is an issue. However, this does tell you that the same agency, the government, who provides you these health insurance plans through these companies and allows for the Department of Medicine through a government agency, also allows for the distribution and legal sale of alcohol. So I just want you to kind of draw that parallel. Moving on. And also to say that liquor stores were allowed to remain open during a pandemic. Okay, that's all I have to say. All right, cancer. According to the latest estimates, the CDC and the National Cancer Institute are estimated at $240 billion costs by 2030 due to healthcare inflation. Well, that's nice. 1.7 million Americans are diagnosed with cancer every year. Remember, there's 7.8 billion people in the world. So statistically, look at the numbers, and 600,000 people die from the disease. They don't die from the disease. They die from chemotherapy. Let's just be very clear on that. Obesity running at number 7 here. 147 billion on healthcare related obesity. So let's just talk about that for a second, because I think that's a brilliant ploy. So you got big ag, big medicine, and big pharma all together, and also big education. They come together The big agricultural system provides the food, which is basically poison sprayed with pesticides and herbicides, things like glyphosate, that are literally going to hijack pathways in your body that destroy your microbiota, your ability to process amino acids, and your ability to detoxify. It's also depleting the minerals out of the soil because it's a more powerful chelator than EDTA. They had to genetically modify plants without extensive research to know how those genetic modifications will actually affect our DNA in the future. So we have diseased, modified, genetically nutrient deficient food that they're feeding you into a system where that deficiency or toxicity will create disease, including systemic inflammation, which is really what obesity is. You have a set number of fat cells by the time you're 22 years old. And we determine how big or small they get. And adipose tissue is actually part of your immune system. It releases pro-inflammatory or anti-inflammatory proteins into your blood called adipokines. And these adipokines are part of interleukin 6 and TNF alpha, aka the cytokine storm, which you heard a lot about, which basically that cytokine storm was the reason people died during COVID. So obesity is just a systemic inflammatory process from toxicity or deficiency. We have a massive gluttony problem. We have a massive mobility issue in our society. We are fatter and sicker than most third world countries. We rank 35th in health in all developed nations. 35th. We're supposed to be the most powerful, advanced country in the world. And we are the sickest, fattest country that I can think of. So public health initiatives such as education and promoting healthier food, well, they can't afford it. You have to pay more for non-poisoned food in the grocery store, which makes no sense. All of these things and our obesity in children is unbelievable. Our children and their lack of mobility, iPads, high exposure to EMF, I mean, we're basically creating self-inflicted suicide. So obesity as a claim on health insurance. Alzheimer's disease, number 8, 16 million Americans provide 17 million hours of unpaid care to friends, family, and Alzheimer's-related dementia. Based on CDC estimates, the amount of unpaid care value is $244 billion. So this disease affects 5.7 million Americans and is the 6th leading cause of death. Well, let's talk about Alzheimer's because there's tons of studies that are coming out about your microbiome, your probiotics in your digestive system in Alzheimer's, heavy metals on the brain in Alzheimer's, and the effects of statin drugs that are one of the highest prescribed drugs for cholesterol and its effect on the brain and its promotion towards Alzheimer's. So go look up those studies. And if you are on a statin, I would suggest you reach out to a natural healthcare professional, get your hormones in balance, get your inflammatory markers down so that your cholesterol naturally falls down, because it's not inflated because it's trying to kill you. It's actually trying to save your life. And when you take a statin to lower it, not that I'm advocating anyone come off their pharmaceuticals because I legally can't do that. Need to talk to your doctor. But if your cholesterol is elevated, it's for a reason, because God is a way maker and he doesn't make mistakes. All right. Smoking-related health issues are another one. That's a $225 billion cost to us a year. Most of the population, it says, lives under the laws that protect non-smokers. Yet again, another little government twist. They allow for the sale of cigarettes and also benefit and tax from it. Yeah, they'll take that money to make you sick and then give you all the drugs to try to help repress all the things that they created. Tooth decay, 45 billion in loss of productivity each year. People need to take off, recover from surgeries. And then finally, the last one is epilepsy. So when I hear people say, I have health insurance just in case, well, unless you are just in casing maybe 3 of these things that maybe could happen, and statistically you would have to look at it like epilepsy, Alzheimer's, and cancer would be the 3 things that I would say a health insurance policy at that point may help you, but it's not going to prevent it for you. It's not going to prevent cancer. It's going to wait till you get cancer. It's not going to prevent Alzheimer's. It's going to wait till you get Alzheimer's. And it's not going to prevent epilepsy. It's just going to wait till you get epilepsy. But cardiovascular, diabetes type 2, alcohol-related issues, obesity, and smoking, also tooth decay. Y'all, you need some K2 and some minerals. Swish with some colloidal silver mouthwash. You can find that on my website. And finally, make sure your microbiota is good, probiotic based, and you'll have healthy, beautiful teeth. So if we think about why we have insurance now, so you're just waiting to get cancer, Alzheimer's, or epilepsy, that's really what you're saying. And so at an average cost of $400 to $700 per person, what if you would find a policy that had a little bit higher deductible? We stop using the medical system as a symptom babysitter, take half of that money that you would save on that higher deductible policy and invest it into natural and alternative, AKA the first medicine. Go see a natural health care practitioner, start changing your lifestyle, eat better, think better, move better, poop better, pray better, do all the things better, go to bed a little bit earlier, make sure that you're keeping an attitude of gratitude, take your supplements, drink your water, do all the things that we know foundationally are really going to help you, and take the money and invest it there. Because I will tell you, there's no policy that's going to jump out and help you, because there's no money in healthy people. There's just no need for pharmacology when you're not symptomatic. And the way you become non-symptomatic is by becoming healthier. And I know there's a lot of people out there that are screaming genetics. Let me tell you this, you're not your DNA. You're your chromosomal expression of your DNA. And your chromosomes receive information by what you put in your mouth, what you think, and what your environment exposes you to. So you can have a physiological response to a breakup with your husband, as well as eating a Big Mac from a fast food place that is going to have tons of junk in it and chemicals. Your body doesn't understand the difference between emotional communication and physical communication. If I come punch you in the face and you stand there and allow me to do it every time, you're going to have a continual bruise on your face and be traumatically impacted. So the way that you stop assaulting your body is to get away from the things that are creating the assault. And so then you will have less symptoms because your body will be healthier. And then you want to put in things such as nutrition to help rebuild pathway systems, functions, and organs that actually are for you. They want to help you live and live long and prosper. So what is the future of health freedom? What do you do? Well, the very first way that you get out of this system is actually to learn how you got in it in the first place. And that takes education. You need to learn for yourself how to take care of your family, how to take care of yourself, and how to take care of the people you love. It doesn't mean that you have to be a doctor, but the word doctor comes from the Latin term meaning teacher. Now, I'm not advocating people drop their health insurance policies. What I'm saying is, as you are waking up in the system, the only way that you will make an educated decision about your insurance or what you want to do with your insurance is to go and discover what else is available to you. All of these therapies and modalities are there for you. And these practices, alternative, the medical community will tell you they're not safe or there's no studies. Well, of course there's no studies, because why would a pharmaceutical company fund a study on red light therapy or the benefits of infrared sauna or a longitudinal study on healthy eating and its impact on obesity? Why would they do that? There's no money in that. They want to prescribe you a pill for leptin resistance. They want to call you pre-diabetic so that they can give you some metformin. They want to continually lower numbers so that you can never be low enough. You can never be healthy enough. I mean, through the years, cholesterol has been the biggest game. That should be fraud, because we know what cholesterol does. It's a cholesterol, LDL or HDL, low density lipoprotein or high density lipoproteins, are fat and proteins together that carry essential nutrients to your body. Why would we try to destroy them? but they can't give you a drug if 240 is the level on blood work. So they continue to lower it, lower it. Now, what are we at? 140? So they just move numbers to hit their numbers. So if they need more sales, they're going to move numbers. And that's basically what we saw happening. And honestly, there has been no improvement in cardiovascular health with the induction of cholesterol meds. 0.0. You can't point me to one study that says that it has helped. It has not. So we have to step back and look at your lifestyle. What are you eating? How are you sleeping? These are what I call the foundations of health: nutrition, hydration, movement, sleep, elimination, emotional, spiritual wellness. And if you don't understand how to do it, I have put together resources for you where you can learn. First resource that I put together was a program called Health 365. And I did that because I started to come out and speak against health insurance and how it was a racket and doesn't really have any insurance on preventative and or benefits that are going to help you benefit your health. It just is a wait to get sick policy, a disease management policy, a repression therapy policy for a system that thinks you have too many organs and not enough pharmaceuticals. So the Health 365 program I put together, which is a month-over-month learning experience for you as a consumer or as a practitioner to help educate your patients. So every month we talk about a health topic. I discuss how that health topic works in the body, say, for example, gastrointestinal health. I talk about lifestyle changes that will help enhance it. I talk about modalities that will help enhance it, supplementation that will help enhance it. And then if you need, after all of that, a pharmaceutical, then I'm okay with it, because pharmaceutical intervention, medical system intervention should not be the first choice we always make unless it's an acute trauma or an emergency. So this Health 365 program is a transformational program that's going to help you get educated to get out of the system. So that's one thing that I did. If you want to find out more about that, it's in the details of this podcast. I also put a code in there. There's all different ways to participate. You can just come in and learn. It's all organized in a learning management system in my academy. So you can watch the videos at your pace. You can implement whatever strategies you want. There's also a live group where everybody is, where we interact and do live chats. We do meetups with the practitioners. There's packages. If you want a practitioner, we have virtual consults available. We do testing. I teach you about the testing, including blood work, how to look at your blood work, how to read your blood work, what does it mean, other testing such as food sensitivity testing, heavy metal testing, hormone testing, the entire thing. 1 year of absolute learning. And at the end of it, you will be able to make 70 to 80% of your choices at home and really embrace real health freedom. Again, if you need to go to the emergency room, you need medical intervention, that's then what it's there for. But it shouldn't be always first. The other thing that I provided was an academy for people that just want to take a few classes to learn about food, to learn about foundations of health. That's called the Academy of Abiding Wellness. Again, you can look at that. And third, a telehealth group. We have a network of doctors of traditional naturopathy that are ready and available for you and your family. There's membership levels where you can come in and pay $69 a month and get taken care of, up to a family plan that's $129 a month that covers everybody in your family. So all of these things are available that give you real root solutions, real education, and they come with a plethora of benefits as well. So this is true health freedom, guys, not relying on a system, not even relying on me, but relying on your own health education and freedom so that you can escape this imprisonment system that we've been put into based on fear. And that's really why you have that policy, because you're afraid that you're going to get sick. And I'm not sure where that fear came from. I mean, nobody wants to die, but guys, that's the fate for all of us. We eventually all die. So truly, It's not about not dying. It's about having quality of life while you're here because God has picked your day and your way already. So nothing that we do is going to change that. However, we can change the path and the trajectory of your health while you're here and maybe prevent some really catastrophic things for you or things that might detract from your quality of life, time with your family, or time off work. So, different ways for you to be empowered: education, Health 365 group, education through the Academy of Abiding Wellness, or start embracing alternative and complementary care with the practitioners that are in my telehealth group. All of those resources are available in the details of this podcast. That's what I came here to say, guys. You know, health insurance is not health insurance. Let's just call it what it is. It's disease management insurance. It doesn't allow you to pick practitioners that you want. You should watch the words in your policies, such as out of network, co-pays. And then for your medical physician, it's also a prison. That medical physician has to do certain things according to the insurance plans in order to get reimbursed for that 15, 20 minutes that they spend with you. And they don't have a lot of time with you because they have to hit a certain quota. And they have to hit a certain quota for jabs and other things in order to be reimbursed by these health insurance companies. So these policies really dictate care in our society today. And it's unfortunate. And as we see big, agencies that come around and buy up all of these facilities, you should worry. You should worry about the fact that these agencies are going around and purchasing these facilities. It's not good. It's not good that they're going to capitalize, especially on our older generation. When United Health is on Forbes 500 list as the fifth largest company, and everybody else is retail and sales. What are we seeing? They're monetizing that system and they're not banking on healthy people to be in it. They're banking on sick people. So the more sick people that they can create into that elderly bracket where, I don't know, do you call it quality of life? If 6.7 million people have Alzheimer's, do you call it quality of life? If most of them are in long-term care facilities that are immobile, that have cardiovascular disease, that have diabetes, do we call it quality of life? I believe that we can age gracefully. I believe that we can have quality into our golden years and we don't have to be part of that prison system, that we can remain in our homes, that we're seeing women rise up having babies in their homes. So guys, this is the time for you to take your health back. Stop giving it away. Stop pouring money into a policy that is not going to benefit you in any way unless you get these really catastrophic things that most are preventable by healthy lifestyle. If the brain takes 20% of your nutrition every single day and neural pathways are built on nutrition and Alzheimer's is lower on the list, third from the bottom actually, then can we prevent that too? Most likely, yes. We just don't have a study to prove it because no one is going to do a study in the pharmaceutical industry saying that you can prevent Alzheimer's, because then why would you be scared and want a health insurance and policy in case you get it? No pharmaceutical company is going to tell you that cancer is preventative. But if you read the studies on vitamin D, if you can dig them out, there are studies that are out there that show that vitamin D blood serum level above 50 in your blood, 50 or above blood serum level, is preventative for certain types of cancers. No one's going to tell you that epilepsy is controllable by alternative methods because there's no money in healthy people, guys. But we'll tell you. Am I claiming cure, treating, or diagnosing? Absolutely not, because I don't believe in disease. I believe in dis-ease of the body. I believe in nutritional deficiencies and toxicity. I believe your body just doesn't have enough to recover, or there's something in the way of your recovery. And if we basically fill the potholes and build the bridges and remove the carnage, God will make a way. That's what I believe. So I hope you find freedom in this. Go check out those links in the details. God bless you and keep you, and may his face shine upon you. And I'll see you next time.